So you were asking what Medicare is. So it's regulated by the US government and it serves more than 55 million people, which is a lot of people when you think about it. It is divided into three parts. There's Part A and B, which is considered original Medicare. And then there's Part C, which is a Medicare Advantage plan, and Part D, which is prescription drug coverage.
Here we've got a guest with us today, and that is Jasmine Anderson. Jasmine, how you doing?
Good, thanks.
Good. Now, Jasmine is actually one of our team members, and the number of hats that you wear, Jasmine, I think is quite a few, almost maybe as many as me. You're marketing coordinator, so that means all the communication that goes out to everyone, really, from our firm comes from you. And then you're also our event coordinator, and then you are also our Medicare specialist. And the Medicare specialist is not something that you're new at. You actually have some history with that. So why don't you go ahead and give a little bit of background on that before we get too far into this?
Yeah. So before I worked here at Miller Retirement Group, I worked for the Area Agency on Aging here in Ottawa, Kansas, in Franklin County. So I was also the marketing coordinator there and Medicare specialist too. So it's kind of similar. But basically at that agency, they are known as SHIC counselors, which is Senior Health Insurance Counselors for Kansas. So they're trained on basically just general Medicare information to help provide unbiased information to consumers. So I kind of have taken that training into what I do now, just to provide the best information for people so that they can make the best decision for themselves.
Well, see, today we're going to be talking about Medicare, since you're the Medicare specialist. And so I think you've got a kind of a presentation you kind of want to go through. And so in order to do that, I think I got to share the screen. I have to give you actually host rights, and then you can share your screen. So we're going to try technology here for a second, people. Hang on one second while we work with this.
There we go.
Yep. All right.
Now we're working. Okay.
Perfect. Now we can see it.
Yeah. Awesome.
Off to a great start.
Alrighty.
For those of us that don't know, like, what is Medicare really?
Yeah, so I'm going to pop this up here real quick, actually, before we start. This is a huge disclosure, but what I want from you to get from this is basically this podcast episode is kind of just more general information to kind of give you some tools in order to help, make a decision for yourself. So I wouldn't take anything that I say and make it a direct decision for yourself because it might be different for you. So our idea is just to expose you to some ideas and tools that you can use for your own decision.
So wait. So you mean that, like, if somebody's talking to their buddy at the water cooler and they tell them what they chose, they shouldn't actually necessarily choose the same thing?
It could work out for them, but I would say the best idea is probably to just make sure, that that's the best decision for you. Yeah. One size doesn't normally fit all in Medicare.
Mm-hmm.
So, okay. So you were asking what Medicare is. So it's regulated by the US government and it serves more than 55 million people, which is a lot of people when you think about it. It is divided into three parts. There's Part A and B, which is considered original Medicare. And then there's Part C, which is a Medicare Advantage plan, and Part D, which is prescription drug coverage. So those are kind of the three essential parts that we'll kind of bounce around with.
Okay, so we'll go into the differences of each one of those.
Yeah, sure, we can do that. So let's see. So Part A is essentially your hospital insurance. So it'll also cover skilled nursing facilities, hospice care, and home health. And then Part B, which is the second part of original Medicare, is more like just your medical insurance. So doctor's appointments, outpatient care, physical therapies, and stuff like that. And then Part C, which is that Medicare Advantage, it's going to cover everything that Part A and Part B cover. You've got to have that in order to enroll in a Medicare Advantage plan. But sometimes they can offer additional services like dental, vision, wellness programs. And so we'll kind of go into the differences between that and supplemental plan. But for right now, we'll look at Part D also, which is a prescription drug plan. So that obviously helps cover your prescription drugs. Okay,
so real quick, it sounds like Part C is more like a package deal, and Medicare Part A, B, and D are kind of, what do you call it, ad hoc, or
kind of like build your own, a la carte, or something that's packaged together. Yep, that's correct.
Okay, so those are the big differences there. What's the cost for that? Because I've heard people that I can't remember the statistic, but there's actually a lot of people that thought Medicare was completely free and did not know that there's actually a cost to it.
Yeah. Yep. There is. I mean, there's so many pieces with Medicare. It's really hard to keep everything straight. So I definitely understand where people are getting, the confusion on that. So we kind of already talked about that portion of it. So we'll go into the costs a little bit. Part A, so once again, that's your hospital insurance. The monthly premium on that is actually $0 for most people who paid into Medicare while working. So if you had 40 work quarters or your spouse did, your monthly premium is generally $0. The deductible on your insurance for your hospital insurance is $1,408 a year. So after you meet that, then you've got the cost sharing that Medicare pays 80%, you'll pay 20%. Other pieces under Part A, if you are hospitalized for any reason, which I'm sure a lot of people have experienced this year with the coronavirus, hospital stays up to 60 days, you'll pay nothing. So that's nice. Days 61 through 90, you're responsible for $352 a day. And then days 91 through 150, you'll pay $704 a day. If you happen to be there after 150 days, you're responsible for 100% of the cost. And I know these numbers are kind of tedious to go through, but I like to explain it just because sometimes people think that's what Medicare pays. They're not sure that that's what they pay. So these charts sometimes that come out sometimes can be confusing too. Mm-hmm. If you happen to have a stay at a skilled nursing facility, sometimes people have questions on what that even is. You break your hip or something like that where you have to go and receive round the care, nurse care, that would be something that you would go there for. So once again, days 1 through 20 this time, you pay nothing. Days 21 through 100, it's $176 a day that you're responsible for. And then if you're there after 100 days, you take 100% of the cost. So that's just Part A. Part B, when you go to see your doctor. Now the premium on this one is not $0. This is based on your adjusted gross income. But for simplicity today, we can just say that most people generally pay $144.60 a month this year. So that can go up based on your income, but we'll just use that. And then the deductible here is $198 a year. So what's important to realize is that after you've paid your deductibles, Medicare pays 80% of the cost and you pay 20%.
So make sure to smash the subscribe button, hit the notification bell. We got content coming out like this every single week. Look at our other website, YouTube channel, Retirement Rescue Radio, which is also our podcast that you can find on Apple iTunes or wherever you end up getting your podcast, Stitcher, SoundCloud, maybe even Spotify. So that's it, guys. We're always trying to bring you more and more content so that we can empower you to live the retirement that you deserve. Take care.